My name is Natalie Tetrick. So an overview of the integumentary system. So it's mainly used for physical protection, storage of lipid reserves. It provides some immune response and thermoregulation. So the epidermis is for protection. It affects the permeability of the skin and it helps prevent against desiccation or water loss. The epidermis does provide some pathogen protection as well, and it also helps synthesize vitamin D. Next is the dermis, and there's two layers of the dermis, the papillary layer and the reticular layer. The main function of the papillary layer is to nourish and support the epidermis, and then the reticular layer helps restrict pathogen spread, and then it also helps to attach the skin to deeper tissues, and there are sensory receptors on the reticular layer. The hypodermis is mainly for fat storage. That's the main function of that. So a clinical application of the integument system in my future career as a hopeful veterinarian would be, I would say, one of the biggest complaints we see in pets these days, especially canines, is allergies. And a lot of those present not as food allergies, but environmental allergies. And so that would be itching, swelling of the skin, hives, and things like that. And so that requires a lot of knowledge of the integumentary system as a whole and why, how the system works. And so that way we can provide the best treatment for the pet. Typically that is, just allergy medications. But that involves a lot of knowledge of the skin system as a whole and why the allergen is getting in there and allergen testings and things like that. Another big application that I see just as a veterinary technician would be in one of the big complaints is lumps and bumps in pets. And more often than not, these are older pets and they're fatty lipomas that are in the subcutaneous tissue. And so we typically do not do anything about those unless they're large or inhibiting range of motion. And so when you do surgery on those, that requires a knowledge of the integumentary system, its depth, where you can cut, how deep you can cut, and how to excise the mass in its entirety. Just routine surgery is another example of knowing the integumentary system in terms of depth. Because when you're doing surgery, you don't want to press too hard, because then you could cut deeper than you want, but you also don't want to turn their tissue into ground beef. So you have to, be precise in the pressure you use when you do cut. Overall, canine allergies would be far superior on my list of things you see every day, and those normally prevent in terms of skin allergens. So overall, that is a overview of the integumentary system and how some clinical applications of use as a veterinarian.